So our respiratory system fundamentally functions to allow us to obtain oxygen and get rid of CO2. So we have part of our respiratory system that is involved directly in gas exchange, and that would be the respiratory surface, which is in the very end of the respiratory tract in structures that are referred to as alveoli, which are deep in the lungs. So when we look at the system, there are other structures, other organs involved in a system. And so the system allows us to first filter, to heat, and to humidify the air. So if we look at the entire respiratory system, right, it includes the nasal cavity, which we're going to talk about in more detail. We should be breathing in and out through our noses, specifically in, because this is what actually allows us to filter the air that is going to end up inside of our lungs. It also functions to humidify the air, which prevents water loss across the respiratory surface in our lungs. And it also warms the air when we breathe in through the nose. Sometimes we breathe in through the mouth, however, right? And so that is connected via a structure in the back of our throat, which is called the pharynx. So the pharynx is part of actually both the digestive system and the respiratory system. So that leads to, it's a common opening to both the esophagus, which would be dorsal or behind, and also to the trachea, which is in front. So here you can see the pharynx located right here, right? Food, when we swallow it, we want it to go down the esophagus and into our stomach. When we breathe, we want our air to go into our trachea. And there's actually a little mechanical valve here that is, we'll talk about, that is called the epiglottis. And this epiglottis, actually, when we swallow food and liquid, it closes off the airway. So you probably all have experienced, for example, getting water or other liquids into your airway, or inhaling, say, for example, something into your airway and having to cough it out. So this is the trachea, and then it is going to go down and into the lungs. The lungs themselves are protected by the rib cage, and they are in what is called the thoracic cavity. The heart would be right between the lungs, right there. And there's actually a cardiac notch in one of the lungs, in your left lung. And that is actually where the heart sits a little bit over to one side, the left side of the body. And then you'll notice that there is a structure here called the diaphragm. It is a dome-shaped muscle, which actually helps in breathing. When we inhale, for example, the diaphragm moves down and kind of flattens out, and that increases the volume of the lungs so that air is automatically drawn into the lungs. And so all of these structures would be part of my respiratory system. Now, let's talk about, when we talk about the respiratory tract, this is the pathway that air takes. And we can talk about like the upper respiratory tract versus the lower respiratory tract. So my upper respiratory tract, sometimes you hear about upper respiratory illnesses, right? So the common cold is an upper respiratory illness. So it includes the nasal cavity, which is also connected to sinuses in your skull. So we actually have different sinuses in different locations. So for example, sometimes you get headaches above your eyebrows. And so that's the frontal sinus. There's actually air space, right? And then sometimes we get pressure, sinus pressure, kind of like right behind the eyes, like right behind the bridge of the nose. And that is what is referred to as your ethmoid sinus. And then sometimes we get pain right here in our cheekbones, and this is what is referred to as the maxillary sinus. So these sinuses actually help to humidify the air. They actually also kind of make the skull lighter because they're spaces in the skull. And then they also resonate. So they have a influence over the resonating quality of our voices. Okay, so we have the sinuses, and then from there, from the nasal cavity, where do we go? We go into that pharynx, which is the back of the throat. So we have the pharynx, and the pharynx is still part of that upper respiratory tract. When we talk about the pharynx, there's actually 3 parts to it. We have what is called the nasopharynx. We have the oropharynx. And then we have that's in the oro would be in the back of the throat. And then we have the laryngopharynx. And so it is actually the laryngopharynx, which is next to your voice box, which is called the larynx. So that is an opening into the lower respiratory tract. So we can talk about the lower. Okay, so we have from the pharynx, we go into the larynx. And we go into the larynx, we breathe in, and this actually is an opening which is called the glottis. So the glottis is the opening into the lower respiratory tract, and it is protected by the epiglottis. So that is a mechanical valve that prevents food from getting into the lower respiratory tract. When we talk about the larynx, the voice box, we have the vocal cords there. And so that helps with when we breathe out, the length and the thickness of the vocal cords, that air vibrates them, and that helps us to create sound. Obviously, our tongue and the shape of our mouth also influences that, that sound as well. But the larynx is what is referred to as the voice box. And in males, it tends to be larger. So they call that the largeness of the voice box would be what is referred to as the Adam's apple, right? It's just because in males, they're larger, which gives them a lower tone to their voice. So from the larynx, if we continue here, we then go into the trachea. And there's only one trachea, and you can feel it on the surface of your throat because it consists of rings of hyaline cartilage. So the trachea is actually an organ that has connective tissue, and then it has epithelial tissue. This is not where gas exchange takes place. So we haven't gotten to that point in our respiratory tract where gas exchange takes place. So from the trachea, we go into the 2 bronchi, which then branch. So they go to the left and the right lungs, so the bronchi. So this is where, for example, when you get bronchitis or inflammation of the bronchi, that would be a lower respiratory tract illness. Bronchitis is inflammation of the bronchi. Then we go into smaller and smaller vessels until we get into what are called the bronchioles. So it's branching. We could talk about the respiratory tree, branches into smaller and smaller vessels. And then we have the terminal bronchioles. And then this is what leads to structures called the alveoli. And the alveoli is where the respiratory membrane is located. This branching into smaller and smaller vessels then leads to a greater surface area, especially the structure of the alveoli. We'll look at it. Our lungs have a huge surface area, and that increase in surface area increases the ability of us to get oxygen and to get rid of CO2. So this increase in the surface area actually increases respiration in terms of gas exchange. So we'll talk about that in a separate video. So let's just look at our diagram again. So we have up here, this would be my nasopharynx. There's actually an opening here to the eustachian tube. So like the back of the throat, the nasopharynx opens or connects to the middle ear part, so that when your middle ear gets stuffy, like you feel like you need to equilibrate the air pressure, sometimes you hold your nose and you blow, and then your ears will pop. That's the reason for that. And then we also have tonsils. So we have these are sometimes referred to as the adenoids. So these tonsils are really important because they are part of the immune system. So as we breathe in, right, microorganisms and viruses come in too. And if they are captured by the tonsils, they can be analyzed, and your immune system can find out what that infection possibly is and can begin to fight off an immune response before it causes problems lower down in the respiratory tract. These tonsils right here are also those are the ones that hang down and you can see them. And then we also have this tonsil that's on the back of the tongue. So all of these areas are part of the immune system and the lymphatic system. They're part of that. This structure right here is the glottis. So this is the opening right there. Air is going to come in. This is the vocal folds, right? Have the vocal cords in them. This structure right here, as I mentioned before, that is actually cartilage. That's hyaline cartilage. And that is going to fold down over when we swallow food and close off the opening to the trachea. Then we have the tracheal rings. Then we have the two bronchi. And going to the left lung, even though this is on the right side, it's from anatomical position. And then this is the right lung, right? And then it branches and branches and branches into smaller and smaller vessels until it branches into the structure that is called the alveoli. So that is my introduction to the entire respiratory system. And maybe we'll talk about more of that in more detail.